I'm Dr. Christopher Nielsen, one of the spine surgeons at Toronto Western Hospital. Let me introduce you to the new Patient Experience and Education Initiative. Please take the next 5 minutes to watch this short video on lumbar radiculopathy. Let's start with a story, Jerry's story. Low back pain with constant leg dominant pain. Jerry's back started to hurt after he returned home from a 3-day car trip which involved sitting behind the wheel for long hours with infrequent stops. By the end of the week, his lower back was extremely painful, making it hard for him to sit or stand for more than a few minutes. During the second week of the attack, his left leg began to hurt, and before long, the leg pain was worse than the pain in his back. Now the pain is constant, much more intense than the back pain, and gets worse with any movement or whenever Jerry tries to straighten his left knee. Jerry's pain is leg dominant, radicular pain. It is true sciatica. Pain produced by direct irritation of a nerve root in the spine. Given the preceding back pain, there is a good chance that the irritation is caused by the herniation of a disc in the low back. The symptoms started in his back, but now they are worse in the leg because now a nerve root is involved. The constant pain is aggravated by anything that tugs on the nerve, like bending forward or straightening the knee on the affected side. If your symptoms are similar to Jerry's, then you are suffering from lumbar radiculopathy. What is lumbar radiculopathy? Well, it is an irritated nerve root. It's the result of pressure on a nerve root. Similar to the jelly squirting out of a jelly donut, a lumbar disc has a soft center, and if that herniates or squeezes out, it can put pressure on a nerve root and cause sciatica-type pain. What are the symptoms that you feel as a patient? Well, the hallmark symptom is leg pain, pain that shoots down the leg, oftentimes all the way to the foot. But you can also experience numbness in the leg, weakness of one or more of the muscles, as well as pain in the back, and you can have a combination of any of these symptoms. Typically, inactivity, things like lying or sitting for long periods of time, will make your pain worse, whereas time, as well as activity, tends to make your symptoms better. So what are your options? Well, number one is we can do nothing. We typically only do that if your symptoms are already improved. Oftentimes, we will talk about interventions that are not surgery. And if those fail to work, or your symptom has been going on for a long time, then sometimes we will talk about a surgery to relieve the pain. Things that are not surgery are largely based on exercise and activity. Injections to block the nerve root, or pain medications that are not narcotics. If we do talk about surgery, oftentimes a decompression and discectomy is what's recommended. And that can be done in a number of different ways at the discretion of your surgeon. The decompression part is to remove part of the bone and ligament to gain safe access to the disc herniation. Once we have that access, we will do a discectomy and remove the disc herniation to relieve the pressure on the nerve root. So what's next? Well, we'll talk about the symptoms that you're experiencing. We will look at your imaging, your MRI, X-rays, or CT scan, and we will consider the impact on your quality of life. And all this put together, we will come up with a plan. That plan may be do nothing. It may be do things that are not surgery, and in some cases, may even be surgery. Thank you for taking the time to listen to this video. You'll see listed here resources that you can access following your clinic visit for further information and education on lumbar radiculopathy.